So how do you know you are going through perimenopause? Well, menopause happens to every woman, and perimenopause is the beginning of the menopause transition. And so this whole thing happens to everyone, and it happens exceptionally unique to each person. However, you can have some insights based on what people in your family have experienced. So some women go through menopause earlier, some women go through menopause later. Some women go through menopause later because they had children. And remember, menopause is ovarian insufficiency. So your ovaries stop releasing eggs. And when you run out of eggs, the gig's up. But if you are pregnant, those months you're pregnant, you're not releasing an egg. So your menopause is then delayed. And the more children you have, the more your menopause is delayed. So you can kind of deduce that if you didn't have a child, you might have menopause earlier. If you have lots of children, you might have menopause later. If you have PCOS and your ovary just doesn't consistently put out eggs, you also might have menopause later. And so there's genetic factors. There is your history of, did you have babies? Did you not? Do you smoke? If you smoke, you might go into menopause a year and a half sooner. And there is a host of things that is part of your perimenopause start in your menopause journey, and people don't know it. And that's why today I am talking about this, because how do you know when to get help if you don't even know what you're looking for? So education is power. I want you to know about the menopause transition, and reaching menopause is just one point of the transition. I actually think it is more important to know when you are in perimenopause so you can start to change your lifestyle, nourish yourself, rest, and be kind of future you. Like good karma, you're going to pay it forward. But if you have no knowledge of it, and then all of a sudden you are hit and you're like, what is this? What is this? Am I crazy? Am I losing my mind? Because estrogen is protective of so many systems. So I like to lead with prevention is better than treatment. And I believe education is power, knowledge is power, and your lifestyle modifications are exceptionally real and very helpful. So this is a validated scale called the MRS scale, the menopause rating scale, and it talks about the different subcategories of symptoms of perimenopause, and it rates it on a 0 to 4 scale. And symptoms of perimenopause and the menopause transition could be hot flashes, sweating. Okay, that's vasomotor. It could be heart discomfort. You could have palpitations, racing heart, tightness in your chest. So cardiovascular issues. Estrogen is cardiovascular protective. You could have sleep problems because you might have difficulty falling asleep, difficulty staying asleep, and waking up early. Because even though you've done nothing different, your cortisol is increasing, and it's a whole thing. Then we have, you feel sad. There is a depressive mood. Now, research does show that it doesn't mean you're more likely to have a depressive episode and be diagnosed with depression. It just means that your depressive symptoms come out. And if you have had a previous history of depression, it is going to rear up. So be ready to do something. Irritability, feeling nervous, feeling anxious, aggressive. You want to punch people in the face. It doesn't say that, but I feel like that best describes it. Anxiety, inner restlessness, feeling panicky. Physical and mental exhaustion, general decrease in performance, impaired memory, decrease in concentration and forgetfulness, because estrogen is neuroprotective. It is very important for your brain. Then there's sexual problems such as low libido, inability to orgasm, bladder problems, difficulty urinating, urinary incontinence, frequency, infections, increased urinary tract infections, increased vulvovaginal symptoms such as dryness, itching, burning, pain with intercourse. Then there's joint and musculoskeletal symptoms, and that is where I come in, because the widespread joint pain, fatigue, tendonitis, frozen shoulder, plantar fasciitis, all these things, and you're like, what is happening? And you all of a sudden feel stiff because estrogen keeps things moisturized, lubricated, flexible, and elasticity. So you know, if your skin is getting drier, your fine lines are popping through, your skin is losing that elasticity, and your collagen is And that applies to your joints and muscles. And this is why me as a physical therapist, I'm talking about this. But I just decided to talk about all of it because I think physical therapists, specifically ones like myself who specialize in women's health, we should all be screening for perimenopause. And I am talking to every single patient now about perimenopause, whether they are in perimenopause or not, because education is power. So now I've changed the way I treat women. When you are postpartum and you're doing really well postpartum, I start to tell you about perimenopause. And I say, you remember those symptoms that you felt in postpartum because you had all these hormonal surges and changes? If you feel that again, that's probably perimenopause, and that's okay. It doesn't mean you're old. I just want you to know when this someday comes back and you feel these feelings, no, I know this. I know I need to talk to somebody. I have felt this before. Planting the seed of knowledge, discussing it, takes away the scariness, the shame, the uncomfortableness of the thought. Because people think perimenopause and menopause happens to people who are old and further down the line. Y'all, it is happening in your 30s. It is in your 40s. And when I start to tell people in their 50s that I know they're perimenopausal, sometimes people clutch their pearls and they look at me like I'm crazy. And they're like, not me. I still get my period. I know you get your period. That's okay. But in the menopause transition, you're going to have lots of other things prior to your period changes. Okay. You are going to have all these other things I talked about. And yes, your cycle will stop. And when you reach menopause, which is 365 days since your last period, then perimenopause is done. Menopause is like 1 day. Then there's postmenopause, and then there's all sorts of things. And I just want you to know, knowledge is power. And someday, maybe when you experience perimenopause, you'll be like, I heard a TikTok video, and she talked about this. And I'm going to talk to somebody because I don't need to suffer, and I deserve to have help with my journey because you were never meant to do this life alone. Okay? You were meant to have a community, and women need a community. You need women who have gone through this before you that you could boo-hoo to and say, I don't feel good. Is this normal? Is this okay? What do I do? And then they can help you, mentor you, if you will, coach you, because we need each other. And then there's people like me taking care of women through all the stages. And I'm like, oh, people need to know. They don't know. And then people need to talk about it. Like, you need to talk about it, because if we talk about it, we take that stigma out, we take that shame out, and we are not normalizing women's suffering anymore. No, we are seeking healthcare, and we are seeking a doctor or a healthcare provider. Like myself, I'm a physical therapist who believes you and listens to your story and helps you on your journey. Hope this helps.